first up, I'd love to introduce Jenny. Jenny, would you like to unmute and share a little bit?
Sure. Hi, everyone. So I am a current case investigator for Mecklenburg County's Public Health Department. I graduated from UNCG in public health, and the reason for working with COVID-19 is almost like a dream come true for public health workers because you're working with a pandemic. So hopefully it doesn't happen again, but it is a rare opportunity, and I'm learning so much about like the healthcare field and everything that goes on daily with constant changes and updates.
Thank you. And up next.
Hi, everyone. Good evening. My name is Madhu Vulimiri, and I work at the North Carolina Department of Health and Human Services. I've been working on the COVID-19 response since March 14th, 2020, full time. So we're getting close to that 1-year mark of responding to this pandemic. At the department, I am a senior strategy advisor and wear a lot of different hats, but with the COVID-19 response, I've early in the pandemic was focused on how we supported our childcare programs when many of them had to close or reopen or stay open, how we did our school reopening, and of course now very focused on vaccination distribution and rollout. So really glad to be here with you and excited to have this conversation.
Thanks so much, Madhu. And then lastly, we've got Hattie.
Thanks. My name is Hattie Gawawnde. I'm also at the North Carolina Department of Health and Human Services. I am the Deputy Director of Government Affairs. And as part of that role, I lead our intergovernmental affairs work, which means that I help facilitate our relationship with our 100 counties and 500 plus municipalities, and have been especially close during this COVID-19 response year, have been very close lately to our vaccine allocation process and distribution process because that's a county-based effort. So looking forward to the conversation.
Thank you all so much. And we will go ahead and roll into the presentations. And I'll come back to that later. So, oh my goodness. Here we go.
All right, I will kick us off. So I'm going to give a little background about where North Carolina is in terms of our COVID cases and hospitalizations and how they've been affecting Asian Americans. And Hattie will give more details on the actual vaccine and distribution and what you should know about the vaccine. So we already did our introduction, so I can just dive right in to the next slide. So first, I just wanted to start with some data to show where we are at as a state in terms of the cases of COVID-19 that are being reported on a weekly basis. So we did have a pretty large spike after leading into the holidays and then the post Christmas holiday spike. We are thankfully starting to see our case numbers come down, but it's still, you can see we're still higher than we had been in many of the fall months. And so COVID is still definitely around, and people are continuing to get sick and get hospitalized and in some cases die from this disease. So it's still very, very serious. You can see the breakdown of who has gotten COVID by race and ethnicity. So Asian Americans make up about 3% of our state. And so Asian Americans have not been hit as hard as some of our other minority groups like Black and American Indian and Latinx. And so this pandemic has disproportionately impacted some groups of North Carolinians more than others. So on the next slide. I'll go through these next few pretty quickly, but I just wanted to show folks the data. This is our hospitalization rates. Thankfully, you can see those are starting to also trend down since January, but that is something that we monitor really closely to see how full our hospitals are, because that can be a big a warning sign indicator that we really have to monitor and make sure that our hospitals are not so full that they can't take care of people who are sick. So this is something we continue to monitor. Next slide. Of course, we track deaths from COVID-19. Unfortunately, you can see the numbers have gone up, followed the similar pattern going into the holidays. And deaths usually have a lag, a few weeks after people actually get COVID. They may, if it's serious enough that they get hospitalized, and then if it results in a death. So there's a little bit of a lag. And so we're still, seeing some of the holiday bump, but it is thankfully starting to go down. So next slide. And this is just looking at how we're breaking down in our vaccination demographics. So I think we are doing really well in vaccinating Asians right now in North Carolina, proportional to our population. Compared to 3% of the state population, about 7.5% of our vaccinations are going to Asian Americans. So we are doing well there, but we know we have a lot of work to do to make sure we are reaching our Black and African American and Latinx population to ensure we're equitably distributing the vaccine. So next slide. So just a little bit of background. I think probably a lot of people know some of this, but just to make sure we're all on the same page about how COVID spreads. So next slide. I think, what we know now really well that we maybe didn't know a year ago is that really the main method of transmission is that COVID spreads through respiratory droplets when we're talking or breathing, doing things like singing, sneezing, coughing. Early in the pandemic, we thought there was a lot of concern about surfaces and like touching things, and that really has become, we now understand that that's less likely for how COVID spreads, and it's really about that, proximity to people and being in spaces that are not well ventilated, like being indoors versus outdoors. We also know that airborne particles can stay in the air for a long time. So again, indoor is more risky than outdoor because of that. It doesn't have the same kind of circulation. And we know that people can transmit the virus even if they don't have the symptoms. In fact, 50 to 75% of people with COVID do not have symptoms. So it's best to assume that if you've been in contact with folks, that you could have it and you could spread it, which is why it's so important for us to do the 3 W's, wearing a mask, waiting 6 feet apart, and washing your hands. And just quickly wanted to show folks, we maintain a county alert system where we give counties red, yellow, or orange, yellow, orange, or red in that order, depending on how much viral spread exists in their county. At the beginning of January and going into the middle of January, the vast majority of our states were red. We are thankfully starting to see some improvement, more orange coming back on the map, but that's still not great. The virus is very widespread at this point and continues to be. And so we do have to keep doing the 3 W's until most of us have been vaccinated. Next slide. So I know folks have been hearing about some of the variants that have originated in other countries. And what we know is that, this is normal, that viruses can continue to mutate over time. So this is a normal process for variants to come and go. And we have been, scientists have been tracking 3 different kinds of variants, the B117, which was first identified in the UK, B1351 in South Africa, and P1 in Brazil. We know that all of those are now in the United States. And I think the good news is that studies suggest so far that the vaccines that we have will provide some protection against these variants. But what we don't know yet is whether they're how much they might impact the efficacy of the vaccine. So we think they will still provide some protection, but we don't know if it will be that full protection. But regardless, it kind of underscores the need to make sure we are continuing to practice the 3 Ws. Next slide. What do we know about the virus and short-term and long-term effects? So next slide. The folks who are at increased risk for severe illness are folks who are over the age of 65 and people with certain underlying medical conditions. My parents both have chronic conditions, so I have been seeing them during this pandemic from a distance outdoors because they are at higher risk. And so this is something that, we see in the data that unfortunately the majority of hospitalizations and deaths have been among older adults, which is part of why with our vaccination prioritization, we have really tried to make older adults 65 plus a priority, and they're currently able to get vaccinated because we know that 83% of the deaths have been in adults over 65. So they're really at quite high risk if they do get COVID-19 for severe illness or death. Next slide. But we know that it's not just death that is a risk of COVID-19. What we are learning is that this is COVID has an impact on other systems in our bodies. We're learning about athletes who are having heart issues, and it's affecting other parts of our bodies, our blood, brain, neurologic systems. And so they're called long haulers, folks who are still continuing to have symptoms long after they've recovered from COVID. Things like extreme tiredness, sleep disorders, shortness of breath. I know people who still can't smell or taste. So death is not the only risk. There are other symptoms. And so this is really, really serious. I think that it's sobering to me that 1 in 5 previously healthy young adults were not back to usual health after testing positive. So this could affect any of us. And more importantly, it could affect people who we love and our friends and family. Next slide. Okay, and then I'm going to wrap up just by sharing a resource about mental health, because this has been a really, really long year. It has been an isolating year for so many people who know that it's really not in their best interest from a physical health standpoint to see friends and family, but we know it's been hard that there's that trade-off on the mental health side. And we know that there are folks who are dealing with more stress and more anxiety, more depression in their lives than before. And so we do have a couple of resources available, Hope for NC and Hope for Healers. Hope for NC is a 24/7 line that anybody can call. It's free. It's a call with a licensed therapist who can, if you're having a crisis moment, that they can help walk you through and help connect you to resources to be able to help manage stress over a longer term, but they can also provide that kind of immediate help that you might need if you're having a crisis situation. So just wanted to make folks aware of those resources. And Hope for Healers, I'll just quickly say, that is specifically for our healthcare workers, our first responders, teachers, people who we know are experiencing a unique kind of stress from being on the front lines every day, day in, day out. So that line is also available, and encourage folks to share that. All right, I'm going to turn it over to Hattie to share more about vaccines.
Thanks, Madhu. So before I jump into these slides, I just want to kind of level set that I think the point of the following slides is to give you kind of a vaccine 101. What do you need to know? But our ulterior motive here is also to recruit you into the group of expert, vaccine knowledgeable people who can then communicate these messages to your communities and to your neighbors. So some of this stuff you will likely already know, but please pay attention to the messages and the language, because it's very intentional. And these are kind of the top line messages that we want everyone in the community to be hearing, ideally from multiple people, prior to getting a vaccine. So next slide, I'll just dive right in. So these are kind of the top line 5 messages that we want to get to everyone in the community so that they can make an informed decision about whether or not the COVID-19 vaccines are right for them. The top message here is that tested, safe, and effective COVID-19 vaccines will help us get back in control of our lives and back to the people and places we love. But under that, there's a few messages in particular that people have found that are not only true, but that people have found persuasive, which is number 1, scientists had a head start and over 70,000 volunteers helped with the clinical trials. Number 2, the vaccines are tested, safe, and effective. Number 3, you cannot get COVID-19 from the vaccine, and I'll get more into that in a few slides. Number 4, supplies are very limited. You'll see this repeated in multiple places all over this slide deck, and it's really, really important to stress to your communities, your neighbors, your friends, your family. A lot of the reason why people are hoping that they can get a vaccine tomorrow and finding they'll actually have to wait weeks and months is because we just aren't getting that much vaccine as a state. And then lastly, regardless, you have a spot to take your shot. Next slide. So let's talk about testing for a minute. So as I mentioned, more than 70,000 people volunteered in the clinical trials for the 2 vaccines that have been approved by the federal government so far, and that's the Pfizer vaccine and the Moderna vaccine. And in the course of those trials, the vaccines were found to help prevent COVID-19 and effective in preventing virtually all hospitalizations and deaths. And at the same time, there were no serious safety concerns in the clinical trials with each vaccine. So we're seeing a lot of hesitancy in communities out there because people are hearing, oh, this is a new kind of vaccine, or maybe they think that it was developed very quickly. But in reality, it's number 1, based on a technology that has been used in clinical research for decades. And number 2, it's now been tested on tens of thousands of people, and there really were no serious safety concerns. Number 3, it went through the same federal approvals that every vaccine that we have to take goes through. It just, was prioritized in the eyes of the federal government, which is why we were able to get approval so quickly. And then the last thing I'll emphasize, which is really important, is that you could have temporary reactions from the vaccine, like a sore arm, a headache, feeling tired or achy for a day or 2. My 85-year-old grandmother participated in the clinical trials for the Moderna vaccine, and she thinks that she got it because she had a fever for a day, but she's also a physician, and she tells me that that's how she knew that the vaccine is working. That's how she knew that her immune system was gearing up to be able to fight the real virus if it ever if she was ever exposed to it. Next slide. So relevant to the conversation today, I think we all know that historically pharmaceutical companies and vaccine manufacturers have not been as good about making sure that their clinical trials represent the population that it will actually be used on, but that was not the case for the Pfizer and Moderna vaccines. There were very intentional efforts to recruit volunteers from historically marginalized populations. I think the key is cut off there, unfortunately, but you can see the orange represents the white share of participants, and then the rest are communities of color. So as you can see, historically marginalized populations were overrepresented in the samples for the clinical trials, and that was very intentional. Next slide. So I'm going to linger on this for a second. Again, I think some of you probably already know this, but there's no live virus in the COVID-19 vaccine. So you cannot get COVID-19 from the vaccine. Instead, the vaccine uses a technology that imitates COVID without actually giving it to you. So it teaches your body, teaches your body to make the antibodies to fight the real COVID-19. And that is what allows you to fight off the real virus if it tries to attack you down the line. So a a lot of people think that this is just like getting the flu vaccine or getting the chickenpox vaccine, and in the sense that there might be a live virus in the vaccine, and that is not the case. So there's no chance you're going to get COVID-19 from the vaccine, and it's really important to stress that to your communities. Next slide. For the currently approved vaccines, that's Pfizer and Moderna, 2 shots are necessary to reach full immunity. So in those clinical trials that I mentioned, the trials showed that you needed 2 shots in order to truly avoid hospitalization and death from COVID-19 at follow-up. The second shot for the Pfizer vaccine comes 3 weeks after you get your first shot. For Moderna, it's 4 weeks. And we built a data system, the COVID-19 vaccine management system, that not only tracks whether you've gotten the proper shots, but makes sure that you get the second shot at the right time and of the right vaccine from your vaccine provider. Next slide. And as you've seen, millions of people in the US have received their first dose. Some very prominent North Carolinians, you might recognize Representative Shelley Willingham here sharing why he got his vaccine, or former Governor Jim Hunt. I think this is interesting because we're starting to see hesitancy really begin to diminish and abate as more and more people are getting their first dose, which is great. And so we can only hope that pattern continues. Next slide. We get a lot of questions about privacy and personal information when it comes to the vaccine, and I'm sure y'all have seen all kinds of things on the internet. So I'll just set the record straight. Nothing in the vaccine can be tracked. It makes a protein that your body processes and disappears as soon as it finishes teaching your body to make the antibodies that can fight off the real virus. It gets processed just like every other protein that passes through your body. And at the same time, your personal information, your sensitive health information is protected at all times. So that COVID-19 vaccine management system is HIPAA compliant. We don't send any of your personal information to the CDC, the federal government. We get questions about ICE, about the Department of Homeland Security. They don't get any of your personal information. And DHS released a statement endorsing equal access to the vaccine regardless of immigration status. And our provider guidance actually says that you're not even required to have an ID or any kind of documentation in order to get the vaccine. Next slide. So I'll pause right here for a second to just reinforce what I said at the top of the presentation, which is that supply is very limited. So our goals are within those constraints to vaccinate as many people as possible, but you should expect for the most part to have to wait. So right now, given how few vaccines we get each week in North Carolina, we only get about 150,000 vaccines each week, and that's slowly ticking upwards, but slowly is the key word there. So we're prioritizing those at the highest risk of exposure to the virus and at the highest risk of severe illness and death from the virus. And then until supply begins to keep pace with demand, that will remain true. Next slide. At the same time, vaccines will be available to all eventually, and it will be available to all for free. So that's really, really important. The federal government pays for the cost of the vaccine, and vaccine providers don't charge any kind of out-of-pocket cost to you in order to get vaccine. If you have insurance, some providers may charge your insurance a small administration fee. If you don't have insurance, they won't charge you anything at all. They have a provider fund that they can use to reimburse for administration. So rest assured, you have a spot to take your shot, regardless of your ability to pay. Next slide. So as I mentioned, we have a prioritization strategy for who should be able to get their shot when, because of those limited supplies. So right now, you probably all have seen that healthcare workers and those in long-term care can get vaccinated, as well as adults 65 and older. You may have also seen that last week, the governor and the secretary announced that we will start moving Group 3 frontline essential workers on February 24, and we will be sub-prioritizing within that, or allowing those who work in schools and those who work in childcare to get their vaccines first before moving to the rest of additional groups within frontline essential workers on March 10. And then after that, adults at high risk for exposure, so those in congregate settings, and those with increased risk of severe illness, so those with underlying conditions, will be able to get it in group 4. And then last, everybody will be able to get it. So there are many ways to get information about vaccines, and information is changing literally weekly, if not daily. And we post all of that information at YourSpotYourShot.nc.gov. So there is all of the latest news on who's eligible and things like that, but also a really detailed frequently asked questions document that gets updated weekly, as well as other deep dive guidance on the priority groups. If you have people in your communities or family who are not as comfortable using the internet or might not have broadband, we also have a COVID-19 Vaccine Help Center at 1-888-675-4567. So feel free to spread that around to your relatives. And then we have 2 additional tools that we found are really helpful to orient people to the vaccine distribution process. And there's more on the next slide, so I'll get into those. So first there's Find My Group, which is a communications tool basically that allows you to input some basic information. How old are you? What do you do for a living? To help you understand where you come in our prioritization scheme, so you know approximately how long you're going to have to wait. And then you can find a vaccine location at the tool on the right there by basically putting in your zip code or your location, and you can find all the onboarded vaccine providers in your area, as well as the best way to contact them. Next slide. So this kind of reinforces that leading medical and professional organizations from various schools of medicine to the CDC to advocacy groups all agree that the vaccines are not only safe, but incredibly important for Americans to take and get vaccinated so that we can get back to our regular lives and keep people around us safe. Next slide. And then if you want to go even a step further and distribute concrete materials to your networks, to your family, to your communities.
Oh, sorry, Hattie, you're breaking up.
Oh, can people hear me?
I can.
Okay.
There we go. Gotcha now.
Okay, great. So if you want to distribute materials to your communities, this is kind of the high level materials that you can find at that YourSpotYourShot.nc.gov website. Like I said, you've got that FAQ, which is updated weekly. A version of this deck is available and updated on the regular on that website, a 1-page flyer, that infographic on prioritization. And then I think one of the most important things on there is that we have these PSA videos from trusted messengers. So community leaders that people will recognize, community leaders that look like the communities that we serve, describing why they are getting their shot when it's their turn. Those have been really powerful in showing the community why it's important to get vaccinated. Next slide. And then this is the last slide. I'll just reinforce what Madhu said during her presentation, which is for the vast majority of us, it is going to be quite a while until we get our vaccines. I know that I'm in group 5. So in the meantime, we can't let the arrival of vaccines lead to us letting down our guard. So continue practicing those 3 W's. That's it.
Thank you all so much for presenting that, Hattie and Madhu. We did have a few questions, so I will throw some of those out there now. So one of them, and a couple of comments as well, one person was saying, I didn't realize that the vaccine doesn't have the virus itself, and that's important to know and share. So I guess one question is, could you reiterate some of like the top line things that you might share with someone who maybe is skeptical about the vaccine? Or isn't really interested in getting it? I know that some other concerns that folks have shared have been, oh, this vaccine was on the fast track, and so I don't feel comfortable getting it because the process was rushed, and that kind of thing.
Yeah, that's a great question. So first of all, I think that those 5 top line messages, which are: 1, the vaccines are tested safe and effective. So highlighting that number that 70,000 people had to take it in order for the federal government to approve these 2 vaccines. And then that, scientists had a head start, and it uses technology that's been in development for decades. Like you said, you can't get COVID-19 from the vaccine. There's no live virus in it. Those are really the most important ones, in addition to sharing on a personal note why you are planning to get vaccinated when the time comes. I think to your specific point about concerns that things were fast tracked, something that I found that helped me reframe this, and that was helpful to help in my conversations with community members, is reminding people that actually this vaccine had to go through all the same steps, all the same federal approvals that every other vaccine had to go through. It just happened a lot more quickly because the federal government devoted all of its resources to making sure that this was the priority, and that these vaccines were able to not have to wait in line behind a bunch of other vaccines before they could get approved. So 1, yes, it's new technology, but it's been in development for decades. It's been very familiar to scientists for decades. And then 2, it had to jump through all of the same hoops with the federal government and the Food and Drug Administration as other vaccines. Madhu, anything you want to add to that, or does that broadly cover it?
I think you hit a lot of the most important points. I would probably just add that, to date, I just checked the CDC page, 55 million Americans have gotten their first dose vaccine. And the other piece is that the clinical trials included folks from all walks of life, all backgrounds, all racial and ethnic groups. And so I think that's a really important piece to know as well, that it had really broad representation of different kinds of people in the trials. So
Thank you. Another question that we had was, who can, and you kind of touched on this, but we have some folks who are specifically concerned about being able to get the vaccine and not being citizens. Is that something they should be concerned about?
Yeah, so we actually so from the very beginning of our vaccine distribution efforts, we've been telling providers and the community that you not only don't have to have an ID to get a vaccine, but you also only have to self-attest to eligibility for the vaccine. So we really don't want there to be any paper barriers to people getting their vaccine. But we've been reinforcing that lately based on feedback from community groups that communities are anxious about this, even if they aren't eligible yet. So we've made very clear in guidance that all providers are required to adhere to in order to provide the vaccine, that ID is not required, and that some hospitals and things ask for ID if you're like an existing member of their health system, and they want to charge your insurance for the administration. But if somebody doesn't have that ID, that it should in no way prevent them from getting the vaccine. It might be helpful for your records purposes, but it shouldn't be a barrier. And we have also continued to reinforce that as we move through the priority groups, that it'll be attestation only. So if somebody is a frontline essential worker in group 3 and they have they're in a profession, or they have an employer who's not as cooperative in providing documentation, for example, that shouldn't be a barrier to getting their vaccine.
Thank you. And I will go into one other one for now, and then we'll get to the other presentation. We'll answer some of the rest of the questions later. The last one was, you shared a few phone lines to contact. Do they have any in-language support that you know of?
Yeah, so the COVID-19 vaccine hotspot, that's not the word, hotline.
Help center.
That centralized line has a Spanish language option, and Madhu, I don't know of efforts in other languages.
I believe it has a language line for people who need to speak in another language. It may not have live interpreters on the line itself, but it uses a language line like others do. I'll put that number in the chat.
And Victoria asked, can we explain what the language line means? That's just the same helpline, but it would have in-language resources for folks who might want to hear a language that is different than English. And y'all can correct me if I'm wrong there. One other comment was, what is the process to get vaccinated if you don't have health insurance?
Yeah, so anybody can get vaccinated free of charge. So you can go to any vaccine provider. So if you go to that tool that I showed on our website, or there's a vaccine provider near you, you'll be able to sign up for an appointment. If you have insurance and when you get there, they might ask for your insurance card if they want to charge a small administration fee. But if you don't have insurance, they will not ask for it. And they have I won't get into the funding, but they have a separate federal funding source for if they want to charge administration fees to the federal government.
Thank you. And last question. Someone asked, I think, and I'll just get a little bit more into some specific concerns that folks had about the vaccine, not being tested for long-term. Some folks don't trust it because of it not being tested for a long-term effect, and some side effects that have been going around on the internet, some scary photos, that kind of thing. So how would you address that, or how could we, as vaccination advocates, address that with some of our communities?
Yeah, great questions. So I'll tackle the one about long-term effects first. I heard Dr. Fauci give a very compelling answer to this, which is that it's true that we only know the 8-month effects of the vaccine, but we know with acute detail the effects of COVID-19. And so, all of these leading medical organizations, the CDC and us, I think it's very, very clear that the benefits of taking the vaccine and avoiding the serious illness and death of COVID is a calculation that I'm willing to make. I understand that other community members might not feel the same way. And I think one thing that helps in my conversations that helps with that conversation is reinforcing that this is not a technology that introduces virus into your system. So you're not gonna, there's not going to be any kind of weird reaction to a virus. The main question that researchers are asking themselves when they look at the long-term effects of the vaccine is whether the antibodies remain active for a long period of time, or whether they eventually, whether eventually you'll need a booster shot. So less concern over the long term in these trials over whether people are going to suddenly get strange reactions and things like that. Madhu, anything you want to add there? That's been the main thing that's helped with me in my conversations, but I don't know if there's anything else on the long-term effects.
Yeah, I think just to reinforce, I think we try to, first of all, we lean into the language about temporary reactions rather than side effects, to really help folks remember that these are temporary, things like fatigue or soreness after getting the shot. They're temporary. That means they'll go away in a few days. They're not dangerous. And like Hattie said, they're a good sign that your body is actually working the way it's supposed to prime your immune system. We do often get questions about allergic reactions. And the thing I think to be thoughtful about is if you're someone who has had an allergic reaction in the past to a vaccine or something that is injectable, you should talk to your primary care doctor about, is it right for me to get this or not? But for folks who just have like a food allergy or peanut allergy, you shouldn't be concerned about getting the COVID-19 vaccine. It's really those folks who've had severe allergic reactions to vaccines in the past should talk to their doctor. And in general, if folks have a chronic medical condition that they're concerned, like I have asthma, should I, whatever condition, we recommend folks should talk to their doctor to figure out, is this right for me? But for the most part, the clinical trials showed that there are no serious safety concerns.
Great, thank you so much, Hattie and Madhu. And we have some other questions, but we will hold those, we'll answer them, but at the end after Jenny has presented. And I also got a question about if this is being recorded and will be available. Yes, this is recorded and we will make this available after the call. And for anyone joining us on Facebook Live, again, we're North Carolina Asian Americans Together. here with Hattie, Madhu, and Jenny, who are some public health professionals here in North Carolina, just talking to us about some things you need to know about COVID. And I will pass it over to Jenny to do your part. So I'll share my screen real quickly. And Jenny, if you want to introduce yourself.
Hi, my name is Jenny. I'm currently a case investigator for the Mecklenburg County Public Health Department. So pretty much what we do is we reach out to those who are positive and try to follow up with them on their isolation quarantine guidance, and also sharing any next steps they can take, and also answering any questions in regards to the vaccine and the virus itself. So what's the best way for me to stay safe, and how can you keep others safe? Like they mentioned earlier, our 3 W's is emphasized by the state, and also paying attention to your symptoms. If you develop any or have any type of symptoms, then to stay at home or to get tested, and when you should know the difference between quarantining and isolating and getting your vaccination. Next slide. So this is the 3 W's that was shared earlier: wearing, waiting, and washing. You want to make sure that your mask is over your nose and your mouth, and social distancing, along with washing your hands as often as possible or using hand sanitizer. Along with that, you want to also avoid large crowds, especially since there's a curfew right now and a pandemic going on. With symptoms, there are various symptoms that you should be aware of, such as coughing, fever, headache is one of the most common ones that we get when we get our calls, sore throats, body aches, chills, nausea, diarrhea. A lot of them mimic either the flu or a sinus infection, and a lot of people misinterpret it as that. But we do highly recommend, if you want to keep yourself safe and others safe, to go ahead and get tested to be sure. Next slide. The CDC actually recently updated some information on masks, how to improve the effectiveness of it. They're saying that you can wear a guard over your disposable masks to help seal the edges of your mask to make sure no extra space is available for your droplets to come out when you're talking or sneezing or anything. To wear one that has a nose bridge, and also to layer your mask. So there's a picture in the middle that has a disposable mask and then a cloth mask. You should wear the disposable inside, and then the cloth mask is to help frame the mask over your face to prevent any gaps. And also, they don't recommend you wearing it with a KN95 mask and then another mask in front of it, because that's going to be harder for you to breathe. So you want to make sure that you can breathe really well with it. But also there's another one where you hold up a fabric mask, and if you can shine a light through it, then it's not recommended. Next slide. So there's a difference between quarantining and isolating. Many don't realize that. For quarantining, it's recommended to do at least 14 days from the last day that you have been in close contact with someone who is positive. Close contact meaning within 15 minutes over the 24-hour period. So it could be 5 minutes during the day, in the afternoon, and then at night. That's your 15 minutes right there. And then if you have ongoing contact with someone where you are caring for someone who's positive, your quarantine would actually start at the end of their isolation time frame. And then we recommend continuing to monitor your symptoms during your quarantine period, the 3 W's, and getting tested if you do develop symptoms during your quarantine period. Now, as for isolation, that's usually for those who are already known positives, and a minimum of 10 days from the onset of your symptom is recommended by the CDC, or from the tested date if you're asymptomatic. And asymptomatic pretty much means you don't show symptoms at all, and you're just a carrier of it, so you're still contagious to others. The guidelines for being released from your isolation is if your symptoms have improved or you no longer have any symptoms, especially a fever or any respiratory symptoms, and also not taking any fever reducing medication in the last 24 hours of your isolation. Next slide. So how can you talk to your community about this? 3 important things are knowing your facts, resources, and getting vaccinated. You want to know your facts, such as COVID-19 is not the only name. It goes by coronavirus and SARS-CoV-2. A lot of people call it COVID-19, simple, but coronavirus has actually been around for a long time, just not the specific strand that we're dealing with right now, along with the other new strands. So precautionary measures to take, such as the 3 Ws, also knowing that your infectious period is actually 2 days before you had your symptoms, and then it leads into the isolation period. And then understanding that it spreads through respiratory droplets, so through your mouth, your nose, things like talking loudly or coughing, sneezing. So you want to make sure you're like covering your mouth properly and wearing your mask, washing your hands as often as possible for at least 20 seconds, or using hand sanitizer if you have it available. Understanding the difference between being symptomatic and asymptomatic. So a lot of the community members that I've spoke with, especially the Asian community, they don't realize how severe the virus is, especially if they're asymptomatic. Or many people who have the symptoms, they assume that it's just a cold or a flu, and they'll do like herbal remedies and all, but then they realize it's actually still contagious and it's spreading and within their own household or their workplace. So what you really want to do is just communicate that message that it's highly contagious, especially if you're not wearing your mask properly, staying within that 6 feet range, and not washing your hands. You want to avoid touching your eyes, nose, and mouth as well if your hands aren't washed. Also, knowing that there are those who are at high risk, like mentioned earlier, being 65 and older, nursing home residents and staff, or long-term care facilities, and those with underlying medical conditions. And then for resources that you can reach out to, there'll be your local health department. You can always look online or visit the phone line or give them a call. For the Mecklenburg County Public Health Department, where I work at, we have it broken down where there's updates about COVID-19, and then the flu vaccine, and then there's the COVID vaccine. So it's constantly being updated. Same with the state's website, the NCDHHS website. It's currently always updated, and so is the CDC. You can reach out to local hospitals and your primary care provider as well. For the vaccine, it's really helpful to get those vaccinated if possible, if they want to, and when they're eligible to, because that helps stop the virus from spreading to others. You prepare your immune system for fighting this virus. It's safe, like we mentioned, it's free. A lot of community members are afraid of that because they're either not insured or they are worried about it being documented, like we mentioned earlier, but it's safe and highly recommend them doing it because we started off by vaccinating our healthcare workers and we need them. So I'm pretty sure we're not trying to take out our healthcare workers. And as for making sure you're eligible, just keep checking online or contacting your doctors or visiting the state's website or any local public health department site. As we mentioned earlier, there are different groups that you can sign up for and you're eligible for. And also, even after being vaccinated, you should still practice the 3 Ws just as a precautionary, since there are new strains and we want to make sure we are following all the steps possible to prevent them from being spread. Next slide. So on the CDC's website and the state's website, there is a language button where you can translate the whole site. In that top picture, you can click on the languages, and then there's a button that says other languages. That'll bring you to the CDC's multilingual content. And I was looking through them. There were quite a lot of Asian languages on there that you can see, and they have flyers, banners, everything is available on there. For the bottom picture, that's the language resources that you can select from the NCDHHS website. So another way, from what I've learned in the Mecklenburg County Public Health Department, we have a language line that we can call. So when you're calling in, we would reach out to the language line to find your interpreter. So that would be one option as well. And then the last slide. So remember to slow the spread of COVID by following the 3 W's: wearing, washing, and waiting 6 feet apart. Also try to clean your frequently touched objects like your phone, doorknobs, countertops, things like that. Try to keep disinfecting them. Try to avoid touching your eyes, nose, and mouth, since you can spread it that way to yourself. And then covering your cough and sneeze, making sure you're doing it into your elbow. That's an area where not many people will be in contact with. So definitely try to follow that precautionary measure, and teaching like your siblings or your friends and family members. And if you're sick, please stay at home until you're not sick anymore. Contact your doctor to see if it's anything COVID related. There are options where you can do virtual visits nowadays. And also, if you're developing symptoms, don't feel well, or you're feeling, or you were in contact with someone or feeling different, definitely go get tested. Most of them are free. Some of them, if you request for like a rapid result or something, some clinics will require a payment, but most of them are free. From where we work, it would be like your local urgent care that's partnering with the health department, or the health department themselves, or your hospital that are doing testing. And that's pretty much everything that I have. Thank you.
I feel like a game show person with my card. So you kind of covered this already, Jenny, but do you recommend wearing a mask after the vaccine? Another question kind of related, I guess, is, are you still contagious after you get the vaccine? Like, can you be a carrier? And so I'll throw this out for anyone, any of the 3 of you to answer.
Sure. And Jenny, feel free to jump in, because I know that you mentioned it, but I'll just say the CDC guidance is currently still to wear a mask and take additional preventative measures even after you get vaccinated. And the reason why that is because we still don't know if you can still spread the virus after being vaccinated. So again, the virus teaches your immune system to fight off the virus if you're exposed to it. But theoretically, you could harbor viral load in your nasal lining and then sneeze on somebody, and you won't get sick, but maybe they are going to get sick. I think that Dr. Fauci and others have signaled that they think that eventually the trials will reveal that these vaccines do in fact prevent you from, or at least reduce your likelihood of spreading the virus. But until we know for sure, we're behaving as though you still need to take preventative measures, and you certainly still need to wear a mask.
Thank you. Another question, kind of similar to that, someone asked about, do you think a vaccine pass would be required for international flights in the future?
Hard to read the tea leaves here. I'll say our approach at the department is, to make sure that everyone can make an informed decision about the vaccine and doesn't feel forced to get the vaccine. I think any kind of pass like that will be of limited use, as long as the CDC is saying you need to mask up and things like that, and you should pretend as though you can still transmit the virus if you're vaccinated. But beyond that, kind of hard to crystal ball there.
Thanks. And another one that we got was, if let's say you're talking to someone and they just absolutely refuse to get the vaccine for whatever reasons, what are some other precautions that they can take either for themselves or for protecting other people? Do they have other options, or is the vaccine just kind of the way to go forward?
I think, yeah, I mean, I think Madhu and I are about to say the same thing. Go ahead.
I mean, it's not rocket science. It's still the 3 W's. It's, you know, keeping space between each other. It's not being in indoor spaces with other people where circulation is not as good as outdoors. It's washing our hands. It's all of the same things, unfortunately. And the vaccine is our additional tool that we have to be able to get back to the places and the people that we love. So, you know, that's why we're here trying to help carry that message as much as possible. And I think the other thing I would say on that is, like, we know that people are processing this and are trying to make their own decisions. You know, with our priority groups that we have, we kind of think of it like an airline boarding model. You know, once your group is called, you can get your shot. So, you know, if people are still thinking about it, like, they will be able to get their shot when they are eligible. So you won't lose your spot if you don't get it right away. But of course, we're encouraging people who are eligible to get it as soon as that it's available to them.
Thank you.
Yeah, I wanted to add as well. There has been a few other community members that decide to go for the antigens or the antibodies treatment, and that's like going to a plasma donor center and then getting that treatment from your doctors or somewhere. But that one's only effective for 90 days. And then with the vaccine, though there isn't much study about the long-term effects of it, and like you mentioned earlier, we may have to get a booster in the future, but I would highly recommend the vaccine and the 3 W's as well.
I'll also say on that point, we don't know the long-term effects of monoclonal antibodies. So just, you know, I think to your point, Jenny, I think we have a lot of information at this point about the usefulness of the vaccine relative to all the other alternatives. And
Yeah.
just echoing what you're saying.
So to sum up what both of y'all are saying, if you were gonna just go get an antibodies test and take that risk, you might as well just take the risk for the vaccine, because we at least have studies for that. Great, thank you. And another question, I will lump these into these two into one. Do you recommend the vaccine for pregnant ladies, and how old do you have to be to get the vaccine?
Yeah, so the CDC changed its guidance and now says that the vaccine is safe to take if you are pregnant. So yes, CDC check. You should, even if you're pregnant, you should get the vaccine when you're eligible. And then the vaccines are currently not approved for children. So I think it's Moderna that's 16 and up and Pfizer that's 18.
Pfizer,
It's the
other
opposite.
way around.
Pfizer is
Yeah.
16 and up and Moderna is 18 and up, and that's because their trials did not include people under those ages. So they are now beginning to start trials with younger folks, but it will be quite some time till we have the clinical evidence we need for our children.
And similar to that question, how old do you have to be to get tested? Do kids get tested, or is that just an adult thing?
I would say, so to get tested for COVID-19, it depends on the clinic. So some facilities, they actually do from like being an infant up until however old you are. And then some don't want to do under 18. It just depends on the clinic. So I would highly recommend calling ahead before scheduling it or visiting.
Thank you. And I have one more question that might be probably just a more conversational one. Again, if anyone has any questions, please drop them in the chat, either on Facebook or in Zoom. And the last question, I guess you might have a lot of different answers for this one, but in general, our communities do already before COVID had a bit of a stigma around healthcare, around going to the doctor, around, you know, some certain treatments in modern medicine. I know that some folks I've been hearing now are kind of like, I'm just going to rely on my traditional medicine, my TCM, that kind of stuff. And sometimes, especially the way that the pandemic has been politicized, it is a little bit difficult to have these conversations with folks who are just not on board. So any final advice for folks who want to talk to their loved ones, talk to their friends, family members, and how can we kind of help speed this process along of getting out of the pandemic? And so I'll leave this up for all three of you. Any that could be like conversational tips, that could be this phrase has worked for me, or like this is my response. So I'll leave it there.
Yeah, I can try and first give it an initial stab. You know, I'm part of the WhatsApp groups, and you know, my aunt's posting on Facebook about the natural immunity to the virus and things like that. And I know it's very hard to push back against those. I'm also fortunate to have doctors in the family who are more fearless than me when it comes to the family WhatsApp groups and push back. I think thing number one is that the only thing, frankly, that has worked for me is to make it personal and to say, this is why I'm getting the vaccine, and this is why I feel I know it's safe. And like Madhu said, there are people who might not feel comfortable at this stage, but maybe after I get vaccinated, unfortunately, you know, probably quite a while from now, then maybe additional relatives will be able to get on board. So for me, it has been the personal approach.
I agree. I think telling, you know, sharing your reason for like what you want to get back to in normal life. You know, I want to get back to being able to give my parents a hug and not feel afraid, and you know, being with our friends and going to concerts and things that made our lives normal and joyful and brought meaning. I think the other piece is expressing that, you know, that we trust it and that this is one of our best shots to beat this pandemic, and that you know, I think the vaccines have done better than anyone hoped in the clinical trials, and that there's more promising ones on the way. So I think sharing your personal reason and also sharing facts with people is the way to go.
Yeah, I would echo everything as well. And in our family, it's only been my grandma that has been fully vaccinated, so we use her as an example. It's not like we're trying to take out grandma, so we're trying to. And she loves hanging out with her friends and stuff, and they're all in their 70s and 80s, and being vaccinated doesn't necessarily mean we're going back to normal, but it is a step of us getting closer to going back to normal. And hopefully we can all be vaccinated soon, eventually, whenever there's more supplies. But definitely making it personal. And then I always mention like our healthcare workers or those running the country have already gotten their vaccines. We're not trying to, you know, get rid of people, but we're trying to actually help stop the spread and eventually being able to just go out to the restaurant or just being able to just sit outside and hang out with your friends again. I'm pretty sure everyone would like that.
Thanks, y'all. And a couple more questions that came in. Do you advise double masking? And does wearing a mask protect the wearer?
So the CDC has put out guidance on this, and we just updated our state level guidance on this. And so I think double masking is not a phrase that we use, but making sure that there's multiple layers to the mask that you use makes it more protective. I think Jenny had a very useful slide on how to make sure you have a high quality mask. And so you've been hearing from the beginning of the pandemic that your mask is to protect other people from you, but I do think the conversation is beginning to highlight also how the quality of your mask will increase the likelihood that you're protected as well. So it's not 100%, but paying attention to mask quality will increase the protectiveness.
Thank you. And then the last question that we have here is, do you have any idea how far from now the vaccine will be available for Group 5?
Man, I wish I had an answer to that question. So
Yeah,
do you,
because we're group 5.
exactly. Yeah, not only because we're group 5, but because we have angry people on our phones every day who want that answer. I'll give a kind of an illustrative example though of how little we can crystal ball can kind of forecast, which is I don't know how much vaccine we're going to be getting 10 days from now in the state, let alone how much we're going to be getting hopefully when a new vaccine or multiple new vaccines come online. And we don't know really the date that y'all have probably heard a lot about the Johnson & Johnson vaccine. We don't really know a precise date when that will come online. So like I said, we get about 150,000 doses of Moderna and Pfizer every week in a state of 10 million. And obviously the vaccinatable population is smaller than that. But at that rate, it will be quite some time before we move to the next group, before we get fully through the next group, let alone all the way to group 5. I will say that we've seen a slight uptick in the number of doses that we're getting weekly. So we used to be at about 120,000. Now we're at about 150,000 a few weeks later. So I think that's a positive sign for the supplies coming from our existing vaccines, but we're really not expecting a huge increase in supply until we have a new vaccine online, and that will likely be Johnson & Johnson. So until that day comes, it's hard to know when things will speed up. And so obviously many months, but hard to know how many months.
Thank you. And thanks so much, Jenny, Hattie, and Madhu. Is there anything else that y'all want to add before we sign off? I know that we're a little over time, so I want to respect y'all's time, but anything else to throw in there before we leave? Final take-home notes?
Just that I hope all of you will be able to share some of this with folks in your lives who are trying to think through this and who may have doubts about the vaccine. I hope that there's information here that you'll be able to point them to. When in doubt, I would refer people back to our website, YourSpotYourShot.nc.gov, for a lot of the talking points that we covered here today. So I think, DHHS, Mecklenburg County, we can't do it alone. We really need folks' help in carrying this message.
Yes, and I would also advise, please be patient with us with the vaccine. Working that hotline and getting all these calls about the vaccine, we don't know. So we're waiting too. And also, there was a question earlier. It was about being infected after getting the vaccine. That actually is possible after your first and second dose. And that just means that your body actually already had it in it and it was taking time before it showed. So that is a possibility, and you would just still follow the same isolation guidance to go through that.
That's a great clarification that the news, I think I'm seeing a lot of news. It's like, oh, look, this person still got COVID after they got vaccinated, like 3 days after their second shot. And it's like, those 3 days, they might have just gotten it during that wait time. The vaccine did not cause that.
Right.
Key.
And it also takes about 2 weeks after your second dose to get full protection. So there's a little bit of a lag time for it to kick in.
Anything else here? I think my favorite takeaway was the 3 W's, and I learned a lot about the vaccines too. Awesome. Well, thank y'all again so much for joining us. Folks who are listening in, we've got, again, more workshops and the testing drive-through coming up. You can sign up for those at ncaatogether.org/health. And this has been recorded, so we will make sure it's available. And after getting some consent from the presenters, I can share out some of the slides as well, either on our website, our social media, or through an email if you are on the Zoom. So thank y'all again so much for joining us. This was so informative, and thanks to everyone for listening in.
Thank you.
Thank
it was nice
you.
meeting you all. Thank you.
Same here.
Bye.